I am Dr. Anita Kant, and you are watching Dr. KK's Med Talks Fridays with Dr. Anita Kant, non-stop show 737th episode. Let's have the headlines of the day. In a major breakthrough, scientists at New Delhi Inter-University Accelerator Center, led by Director and Allahabad University's adjunct Professor Avinash Chandra Pandey, have successfully developed India's first superconducting magnet system used in MRI machines for a whole body clinical scanner. WHO launches drive to fight bacterial meningitis in Africa. FDA warns of potential clip lock issues with Abbott's heart valve repair device. US is considering expanding monkeypox vaccine eligibility to men with HIV. Active COVID cases in the country declined to 49,636. Now let's go to the topic of the day. So today we will be talking about Tai Chi for doctors. Doctors are one such community which never takes care of their own self. And today we have our special guest, Dr. Sunil Srinivasan. He is a consultant pediatrician and an international Tai Chi instructor. He is body-mind wellness expert, a Himalayan trekker, and a meditator. He is the past president of IAP Tamil Nadu. He is also the founder of Happitude Stress Relief Program. So welcome, Dr. Sunil Srinivasan, and we are very happy. We are very happy to have you here, Srinivasan. And let us start talking today about what is it all about that the doctors should know about their own fitness. So how do you define fitness at the first instance?
Yes. So whenever we say fitness, the first image that comes to your mind is that of Hrithik Roshan. So you have all bulging muscles and sculpted body. But surprisingly, physical fitness or even physical appearance is a very small part of the entire fitness spectrum. So if you take health-related fitness, there are three major domains. As you know, we have the physical, we have the mental, we have the social. And each of these further subdivided into strength, flexibility, and balance. For example, you have physical strength, physical flexibility, physical balance, and so on for your social, mental, which means we have 9 areas in which we have to become fit. So as we go along, we'll discuss all this. So fitness is a huge, huge topic. And in the next half an hour, we'll try to condense as much as possible. Thank you.
So what is the simple evaluation of physical fitness at the first
Yes,
go?
in fact, if you look at standard exercise manuals, a lot of charts are given depending on age, what should be how much should be able to squat and so on. Very, very tough to follow all those charts. So I have only five simple things to follow physically. The number one is body mass index. If your body mass index is less than 25, you are good. The second thing I want people to check is the resting pulse rate. That is, as soon as you wake up in the morning, before you get up, count your pulse. If your resting pulse rate is around 60, not 72, around 60, that means you got good vagal tone, you're good. The number three I tell is measure your waist circumference. Now, anything less than 95 centimeters is good, but you want to be more technical in waist, it should be less than half your height. So whatever height is in centimeters, half it. If your waist is around that, you're good. 3. Number 4, if you're able to stand and touch your toes without bending your knees, without any difficulty, that's good. And finally, if you can stand on one foot, and balance for 1 minute, you can keep your eyes open, no issue. I think all these are the 5 simple things all of us can check daily. These are good. You're physically fit. Thank you.
So why should doctors be fit? That I'd like to know.
A very, very good question, Dr. Anita. Because see, medicine is very cerebral work. So we think, why should we physically fit is a good question. And there are many, many answers to this, but I'll just tell you three or four main replies to this question. The first thing is being physically fit helps you to sit through the entire day. Otherwise, through from morning to night, seeing that you need to have stamina, you need to have patience. So not only it gives you stamina to sit throughout, examine each patient carefully, more it gives a lot of clarity of thought. The more fit you are, the more better you can think. Number one. Then mentally, all of us are subject to so much stress, madam. We're going to talk about it
Yes.
soon. So, physically fit, body and mind are totally connected to each other. So, if you are physically fit, you can handle all the mental stress much better than otherwise. And finally, socially, I want to make a sad point here. All of us are going to become old one day. All of us are going to become bedridden, immobile, and we are going to become burden on our children. It is inevitable. You can't escape that. And even if the children don't mind that, so by being physically fit, you are trying to postpone that immobility as much as possible. We are trying to become as less a burden to our children, and that we should keep in mind. So I think these are the main factors. I always feel the doctors are the cream of society, and we should set example by being fit. There's no point in me being unfit and telling the patient do this, do this. It doesn't make sense at all. So instead of doctors telling what to do, show them what to do. Show by example. So these are some of the reasons why doctors should be fit. Thank you.
So you suggest that doctors should lead by being an
Example.
example themselves.
Yes, ma'am. Yes,
So,
ma'am.
how many times a week should we do workouts and for how long?
Yes, ma'am. The my policy on that is you work out every day. There is no holidays for workout. The only day you're allowed not to work out is if you're fasting. Some people do the Ekadashi fasting and all that. Fine. On that day, you're excused. But there is no holiday for workout. You have to, just like your heart and lungs work every day. You have got to work every day. There is no excuse, no shortcuts there. And for how long?
Right.
100 minutes is what I advise. 100 minutes. And these 100 minutes, the way you divide it, so 40 minutes for cardio. We'll talk about it very soon. So 40 for cardio, 30 for stretch exercises. Stretch exercises, we'll tell about that. And 30 minutes for meditation. So 40 plus 30 plus 30 is 100. This is the minimum you got to spend on your body every day of your life. There are no vacations, no holidays for this. The people are going to protest. I don't have 100 minutes. I'm so busy. I'm a busy doctor. But this body has been there throughout your life, from your womb to tomb. It's a poor thing, supports you throughout life. This is the only thing you call your own, man. Nothing else in this world is your own. Not your money, not family, not your knowledge. Knowledge is borrowed. I read from books and read. And not even your mind. Mind is all conditioned mind. But body is absolutely your own stuff. Please take good care of it. 100 minutes is what you want, the body wants from you. Thank you.
So, despite knowing that we should work out daily, why are we reluctant to exercise?
Yes, ma'am, that is very, very, very true. And I'm sure most of us agree. And this is has puzzled scientists for a very long time. What is this happening? I mean, doctors tell smoking is bad, and so many doctors smoke. You tell alcohol is bad, so many. I mean, what's happening? I mean, what is this puzzle thing? You know it's bad, and why do people end up doing it? So, for a long time, we thought it's something like willpower. No, somebody has willpower and somebody doesn't have willpower. And now we know it is not. There's a very strange story happening here. What we know that the cerebral cortex is what does the thinking for all of us. But now we realize that cerebral cortex is being manipulated by a small group of nuclei which is sitting deep in the brain, and this is called the basal ganglia. Now, basal ganglia is an evolutionary remnant from a reptilian brain. So, our ancestors are reptiles. So, we have inherited that brain from reptiles. Now, this basal ganglia is very simple. Doesn't have many complex things. It knows only two or three things. It knows pleasure, it knows pain, it knows fear. Only three things. So anything that is painful, it will say, no, don't do it. Pleasure, yeah, come on, let's do it. The basal ganglia is not bothered about your health or fitness, nothing. It wants to be keep happy herself. No pain, only pleasure. So what happens, what studies have shown is that when you think of doing exercise, when you think of not exercise, when you think of doing exercise, it sends painful impulses into your brain. Painful impulses. This pain is equivalent roughly to a 40-volt shock. The same pain which a 40-volt shock causes is the same pain when you think of exercise. So whenever you think of exercise, the basal ganglia is painful. Come on, are you mad? Why are you doing this? Don't do it. Relax, have a cup of chai or watch the TV or whatever. Have a chocolate. What are you mad? Why are you doing painful thing? Come on, get off it. So, but the cerebral cortex is like a big elephant, no? So manipulated by small. So what it does is it says, you know what? Let us not do it today. Let us take relax. Maybe I'll do from tomorrow, or maybe from some auspicious. Maybe from New Year I'll start, or my birthday. So it just rationalizes. It has given up hope, but so that's the reason why people join on gym on New Year Day, and those people offer 1 year for 6 months, and none of the guys pass the January. After January, everybody stops going. So what I'm telling is, we are manipulated by basal ganglia, and that's the reason. We are not us. We have to blame our basal ganglia. Thank you.
So how do we overcome this initial resistance, produced by the basal ganglia to
Yes, yes, madam.
anti-exercise?
Yes, man, absolutely. Anti anything good, man. Anything good, Basil doesn't like it. Yeah. So it wants you to take all starchy food or oily food, everything. Come on. But nothing is going to happen. After all, one samosa this day, what going to? So this is the evil basal ganglia. Anyway, so the way to overcome basal ganglia is to stop thinking. Stop thinking. I'm so sorry to be very dramatic here, but suppose you want to do exercise, do it. Don't think about exercise. Just do it. For example, I come from a hospital every day and I do treadmill. And even before going to the hospital, I keep all my dress ready, all my t-shirts, shorts, my shoes, everything is there on the treadmill. The moment I come home, I change my dress, get on the time, start. I don't think about doing, I just do it. So what happened? That's the best thing, but it's a very. I mean, I can say, but people find it difficult. So what I can suggest a nice trick to fool the basal ganglia. So basal ganglia like a child, no, very adamant child. You got to be very patient with the child. So what you say to the basal ganglia, let's do for 5 minutes, just 5 minutes today. Okay, basal ganglia, be calm. Okay, ठीक है, पक्का 5 minutes. So you know what? So you get on the table and do for 5 minutes. Then after 5 minutes, can you just for 5 more minutes? Just paki baat this time. I'll do just for 5 more minutes. And we said, okay, I don't mind. So another five. After 5 minutes, it will give up. You know what? You do whatever you want. I'm not bothered. So that is the magic of exercise. You start, don't bother. Even if you're feeling, I felt many days, I come at 11 o'clock and should I do? Maybe I can sleep. Maybe I can do this. I get on the treadmill and fight. After 10th minute, it changes. The brain wiring changes. You're happy doing it. So that's a way to overcome this evil. The other way you can do is you can call a friend, some friend who's interested. You can call a friend or a spouse who can motivate you, or have a personal trainer. A lot of people have personal trainers and they motivate you. And women have a very nice way of countering this, men, not men but women. What they do is they anticipate a social function. For example, like this wedding is coming, so I have to fit in this lehenga. I'm not fitting in this lehenga right now, but you know what? 3 months
Right.
I'm going to have some motivation. So either whatever works for them, the multiple methods. So be motivate, but don't do much thinking. Start exercise. Thank you. Thank you.
Just go for it. So what is the
Exactly.
best cardio that you will suggest?
Yes, ma'am. The best cardio, safest, most convenient, most validated, with my most personal experience, is a treadmill. So I've been using a treadmill for more than 25 years. Absolutely safe, no issues at all. The reason I'm telling, if there are orthopedic colleagues watching here, some of them are against treadmill. They feel it might damage a knee joint, but it doesn't damage. I can assure you. The thing is, you can either run on a treadmill or a walk, but I only walk. I walk for 4 kilometers an hour. I put the treadmill at 15 degrees inclination. I walk for 40 minutes, 40 minutes. The reason for 40 minutes is the first 30 minutes of any exercise, the body utilizes only the glycogen, either the liver or muscle glycogen. It is only after the 30th minute it starts utilizing the fat. So if you want to burn your fat, progress beyond 30 minutes, So 40 is good, even 60 is much better if you have time. After 60, there isn't much benefit. So work beyond 30 minutes. Don't stop at 30. So, and treadmill is the safest. If you're going to buy a higher end model, so a normal treadmill costs about roughly about a lakh and some small change, and that's the safest. It doesn't damage your knee joint. They're all very springy kind of treadmills, so go for it. That's the best cardio mill. Thank you.
So, why should we do stretch exercises?
Yes, ma'am. So there are two different aspects of stretch exercises. The first thing is the more flexible your body, the more comfortable your life. It's such a profound statement. So not many people talk about flexibility because throughout your life you got to bend down, pick up things, go here, go there, climb up. It needs flexibility. So we need to be as flexible as children. You see, children, they have no problem. They climb trees, get under the bed, but we have to struggle because our body is not flexible. So the more flexible you are, the more pain-free you are. The more rigid you are, the more causes a lot of pain. This is number one. And number two, when you do stretch exercises, you strengthen your tendons. Now, tendons are very peculiar structure in the human body. Tendons have to be strong. Tendons have to be elastic too. So these combinations are very, very rare combination. It has to be stretchable, elastic. Same time, it has to be strong. The best thing about tendon is a chemical structure. It doesn't have much cellular structure. It's a collagen fibers, all long bundles, consumes very less energy, and it doesn't age at all. Unlike your muscle or heart or brain, tendons don't age. They are 20 or 80, the tendon is almost the same. So that's the reason, even if you keep your tendon strong, you can be as powerful or almost as powerful at 80 than at 20. I was doing in China my Tai Chi, and I saw one 75-year-old lady. She was delivering all the gas cylinders. So she just picked up one gas cylinder from the put it. I was amazed. This old lady looking so frail. She didn't look muscular, very frail, thin, small. So, and then after age, I'm 75. So imagine, because she had strong tendon, no muscles but tendon. So all of us can, by stretch exercises, you strengthen your tendon, which doesn't age, keeps you fit throughout life. So these are two reasons why we should do stretch exercise. Thank you.
And how do we build up our mental strength? This is about physical strength, but how do
Yes,
we
yes.
build up our mental strength?
Yes, madam. Yes, madam. We have to learn from women only, but how to be mentally strong. All women are strong. I think you can give us better tips on how to be mentally strong. But I believe the pillars of mental strength are three, madam. One is simplicity. Simplicity. The more simple you make your life, the more mentally strong. The more complex your life, you obviously so much tension, this and that. So simplicity is number one. Number two is patience. Number two, we are all hurried people. We all want things to happen in a hurry. So the more patient you are, it builds up your mental strength. And finally, compassion. These three combinations: simplicity, uh, compassion, and patience. And women being mothers, if you're a child, if you have a child, you got to have all the three. You have to be patient, you have to be compassionate, and be simple. I mean, you try to. So I think that is a lot of people, we forget these values as we go along. So any task which has these three will make us strong. Thank you.
So, why do we need mental flexibility for all of this?
Yes, better. So, what happens is mental strength alone is not enough. Mental strength alone is not enough. I'll tell you an example of my grandfather. He had 15 children, mentally very strong. I knew him well. And he has raised all the 15. Everybody has done exceedingly well. All my uncles, aunts, all done very well. Mentally
Really
very
nice.
strong. But towards the end of his life, he became very sad, depressed because his sons never listened to him. They all went on their own path. He wanted this for his son. They don't know. We don't do this. They're all doing well, but he was not flexible enough. So he was mentally strong, but he was not adaptable. So as we grow older, everything changes. Technology changes, expectation changes, the relationship between our spouse changes, children have their own ideas, the community changes, the politics change, everything changes. But unless you are flexible, you won't be able to. You will start feeling depressed. You say, "What? In my days, मेरे जमाने में ऐसा होता था, अब क्या हो रहा है, क्या, no, this is all gone. Your zamana is gone. You have to change. That flexibility gives you a lot of comfort in life. Thank you.
So, another thing I would like to know, how do we stimulate all the areas of our brain?
Yes, ma'am. Very, very good. What have all of us are doctors? I know that we have our all work a dominant hand and non-dominant hand, and by using our right hand, we keep on stimulating mainly the left area of the main left area of the brain. So I learned some time ago, some years ago, that one of the best way to stimulate the brain is to use the non-dominant hand. So what I do is every day I start brushing with my left hand. So it was very awkward to begin with. Now I'm sort of getting used to it. So that's a one first very easy thing to start using your left hand for or combing hair or dressing or putting buttons or even starting writing with the left hand. It is awkward. It is very, very strenuous. I know, but that's how we stimulate the brain. The second thing we can do is take up art, madam. Art is a very right-handed act, right brain activity. So you can take up drawing or painting or music, anything that is very non-logical, non-sequential, intuitive, that kind of activity. So in the corona time, I had to close my hospital, sitting at home. I thought, why not start drawing? I have no idea of drawing at all. I've never drawn in my life. In my school, all my drawing classes I used to get zero because I used to draw so horribly. So I thought, why not start drawing? So in the beginning, I couldn't draw even a single straight line, all crooked. But at plenty of time, slowly I've improved. So over the 2 years, I slightly improved, man, not that bad. Can you show a picture I drew, madam, 2 days ago? Can I show a picture here? What I
Yes,
drew?
yes, yes. Yes,
Just
yes.
hang on. I hope this is visible or can you see this picture, madam?
Yes, this is
Can you,
beautiful.
can you guess what it is?
No, is it the Golden Temple?
Yes, ma'am, you got it. Yeah, that is Golden Temple. That is indeed Golden
Very,
Temple.
very pretty, very pretty.
Thank you, thank you. I am happy recognized it. So I know I'm slowly improving. I'm quite happy with my progress. So the idea of
It's a
drawing
real
is
good thing.
thank you, ma'am. Thank you. The idea is that
Definitely.
you stimulate all your brain by taking up any of the art. It doesn't matter how bad you perform. Just do it. You'll be much happier. Thank you.
And what exactly is social fitness, if I may ask?
Yes, ma'am. Yeah. See, we talked about mental fitness. We talked about physical fitness, social fitness. Very important modern age with all the social media coming. All my patients ask, the doctor Saab, are you on Facebook or you on Instagram? I'm not there. I am there, but don't even go there. My daughters have added my name, but I don't go there. But that I think I should change. And all the younger generation, I don't have. But go make your social presence. That's all telling. What I do is I am in WhatsApp and I keep in touch with all my patients. So anytime a patient has got doubt, they can send me a message or WhatsApp. I'll try to solve anywhere from any part. Most of our patients have gone to US, so from that they send a message. So I help them. So that way you stay in touch. So with all your patients, that is social fitness. And the second thing is do networking. Try to meet as many people as possible and make your social content. It was no longer applicable in my practice. We just went by word of mouth. But today they want social presence. So be in social media. Keep in touch with all your patients. Thank you.
Now I think the younger generation has moved on from Facebook also and gone to Instagram.
Yes,
So
Instagram.
we are
I know.
lagging behind, right?
Yes, yes.
So that is the way to improve our social balance. I agree. But how does meditation fit in? How is it important in our lives?
So meditation is just for a lot of people, it's a very scary word. It just means calming the mind. Calming the mind. That's all it is. Meditation is not concentration. It is more relaxation, calming the mind. So there are two methods mainly for calming the mind. One is what is called that classical pranayama. You take in through your breathe in through your left nostril, let it through right, take it through right, left. That's a very everybody knows pranayama. 20 minutes of pranayama is enough to calm your mind because it balances both your sympathetic and parasympathetic. The other method is what is called watching your thoughts. Close your eyes, very simple. Just keep watching your thoughts. Every time a thought arises, let it go. Don't hold it. So this is called letting go meditation. Just Make the thought into a balloon, let it go. Another thought, balloon. No, it's not as simple as I say. It's quite tough. I've been practicing letting go for the past 10 years. I have not progressed 1 inch, I'm telling you. Every time I think all thoughts are, but the best thing, it is not success in the, it's just the process. You're attempting that alone is enough. You don't have to succeed in it. And this letting go is very popular in the United States. A lot of people practice it with enormous benefit of letting go. Just 20, there's a lot of material in the net, madam. So letting go not only is mentally good, it also lowers your blood pressure, your pulse rate, your oxygenation, your cortisol level. Everything comes down with letting go. Meditation was the best exercise for physical well-being, not even mental. Even physical well-being, meditation is good. Thank you.
Actually, I believe that we Indians stress a lot about, doing puja. So, this
Yes,
thing
yes,
has to be put here, this thing has to be put here, this is one
yes,
step, this is the second step. So,
yes.
all those small rituals of the daily puja, and then you end up reading all the mantras with your eyes closed. I think that is
Correct.
another way of meditation, taking yourself
Absolutely.
all away from whatever is happening around you and trying to be one with God. You may not succeed, but at least you manage to let go of all the stress, right?
Wonderful,
You
ma'am.
agree?
Perfect, perfect,
Right,
perfect
right.
example, ma'am. Perfect example.
Thanks.
Yeah.
So, doctors are a stressed lot with an
Yes,
additional lot of patients' illness playing with their brains all the time. And the
yes,
routine life burdens are all like all other human beings.
yes.
So, how can exercise, physical exercise, help as a stress buster?
Correct, but there are plenty of studies showing the various ways exercises help. But simply two or three points I'd like to make. Once you do exercise, it releases so many hormones, like your endorphins, you have dopamine, you have
Yes,
serotonin. All this goes and affects the brain and makes it all positive hormones. It makes you think in a much better way, relieves your stress, gives a perspective. Even if you don't think about anything, a half an hour exercise completely relaxes you. All studies have shown that it's wonderful, wonderful exercise, stress buster. The other good thing about exercise is, as you exercise, you become more shapely. We started with the shape of the body, and we're coming back to shape. So even though shape of body is not important, but still you feel self-image is important in our
yes,
for stress. So
yes.
more confident you feel about yourself, the more happier you are. So if your waistline is becoming better, your pants are fitting, or what your dress is fitting, you look good. People tell, "Oh God, my God, you're slimming down, Dr. Anita. You become so." Then you're automatically all your stress is gone. You feel happy. And the opposite, if somebody says, "Oh, but what would I have you put on weight?" You feel so depressed for 2 days. So it works both ways. So I think that's the way exercise makes you both bodily as well as mentally uh, much happier, relieves your stress. Yes,
Exactly. Happitude is the word I would say. If you do
yes,
some exercise and with a
yes,
positive mind. Right,
yes,
right. I
ma'am.
agree
Yes,
with all
yes.
of this. And I
Thank
think
you.
although we have talked about fitness for doctors, but
Yes,
listening through all your answers, I feel all of this fits onto a general public person as well as any doctor. And you have gone point wise for everything, so I think I'll go through the interview once it's over again
yes,
and
yes,
note
ma'am.
them down in my brain, or maybe note them
Yes,
down on my copy
yes,
so that I
yes,
can
ma'am.
refer whenever I need it. Thank you so much,
Absolutely.
Dr. Sunil. You have really done a wonderful job today. And next
Thank
week
you, ma'am.
we'll move on to the
We'll meet.
third part of
We'll meet.
our, yes,
Yes, ma'am. We'll meet. And so
definitely.
nice. Take care.
Sure.
I really enjoyed this talk. Thanks to you, ma'am. Thank you.
Thank you.
Thank
Could
you.
you show us the certificate, please?
Thank you, ma'am. Thank you. So nice.
Thank you. Thank you, Dr. Sunil.
Yes,
It
yes,
has been
thank
a
you, ma'am.
pleasure having you over for the
Thank
second
you, ma'am.
time. And
Yes, ma'am.
this will be all for today. Dr.
Yes.
KK Med Talks will be back tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK's Med Talks. Namaskar.
Namaskar.